Ask any working parent and they'll tell you finding affordable, quality childcare is a full-time job in and of itself. Now, state budget cuts are putting more limits on their options, including a freeze on new applications for New Jersey's Child Care Assistance Program that helps both providers and low-income families at a time when the cost of everything from groceries to gas is going up. Raven Santana spoke with parents, child care advocates, and providers about the impact of losing this subsidy.
Across New Jersey, the joyful sounds of childhood play mask a growing crisis, one that could upend the lives of thousands of working families. As of August 1st, New Jersey's Child Care Assistance Program, known as CCAP, has slammed the brakes on new applications, putting affordable care out of reach for families who rely on it the most.
As of today, no new families can apply to the program. Families that are currently in the program, if they wanted to add an additional child, they could not. And families at redetermination or renewal will face higher copays.
The reason? A $30 million shortfall in the state budget, money that advocates say would have kept the program running at full capacity. Now those left out say they'll have to make impossible choices. An estimated 70,000 children currently benefit from CCAP, but without new entries, that number could steadily decline, leaving working families, especially mothers, at risk of falling through the cracks.
An increase in a copayment for some families could mean deciding between, do I eat today or do I not eat?
CCAP is administered through the state's Department of Human Services. It provides direct subsidies to child care providers and supports families earning up to 200% of the federal poverty level, about $62,000 for a family of four. The impact stretches beyond the home. In a state already struggling with a worker shortage, advocates warn that these changes could hit businesses just as hard.
There is a workforce shortage. This is only going to make it harder. Families are really going to now have to decide between working or staying home.
And small in-home child care providers are already feeling the strain. In Toms River, Michelle Stroud runs a home-based daycare. She had no warning.
So I had no time to plan, no time to tell the parents, like what's going to go on. Also, like if you have a family that, let's say that his mother was pregnant, she comes after, deliver the baby, in December or September or whatever. They're not going to put that child on his subsidy. So that means that she's going to have to end up pulling these two kids out so that she can stay home with them and I lose my kids.
If co-payments are going up, then that's more money coming out of my household budget. If I can't go to work, then I do not have food. I can't feed my children. If I can't feed my children, then I'm neglecting my children. If I neglect my children, I'm at risk of others or the state getting involved. And if the state gets involved, then what happens to my kids from there? When my only desire is to make sure that they're well taken care of.
Tanisha Moses says the increase in copays could push her to the breaking point.
That ripple effect means that if she's unable to support us because she can't support herself, then we're not going to be able to support ourselves. And then where does that leave the children, the most vulnerable population?
But I'm just going to have to take it day by day. I might have to take a step back, and try to figure out what else can I do. But, that would hurt my heart, but what can I do?
Some legislators spoke out during a town hall about why the freeze would be detrimental to families and have pledged to work with Governor Murphy to revisit the funding gap, saying in a statement, "We are confident that together we can find a solution and support more children and families in every community." But until then, the freeze remains and its effects are already being felt across the state. For NJ Spotlight News, I'm Raven Santana.